Welcome to A Date with Darkness podcast, where I will be discussing the impact of hurtful and abusive relationships and how to overcome them so that you can move through your pain and get to the kind of healthy relationships you want, need, and deserve. I'm Dr. Natalie Jones. I'm a licensed psychotherapist based in California. While I hope that you find this podcast educational and informational, please note it should not be substituted for treatment with a licensed mental health professional. Also, due to the nature of the podcast, some of the information presented on the show can be sensitive to some of my listeners, so please note that listener discretion is advised. Hello, and thank you for joining me for today's episode. I have a real special episode planned for us today. It's one that I've been thinking about for quite some time, and it's one that I think is very much needed. You know, when the women that I work with are experiencing relationships that are abusive or hurtful, they often seek the advice and comfort of their doctor, and their medical doctor, that is. So a lot of women that I've worked with oftentimes will seek out services through their Ob-Gyn or their primary care physician, and oftentimes talk about just their own personal symptoms. And with this specific episode today, I'm going to be talking specifically about going to the gynecologist and some of the red flags that may come up for women, as they go to the gynecologist. And I think it's significant because a lot of times when we are in abusive relationships, what we don't have control over, or what we lose control over, is the health and the sacredness of our own bodies. And so I brought on a very special guest to definitely provide us some clarity and insight around that. And so without further ado, here is Dr. Joyelle. She is an obstetrician and gynecologist, and she's going to be here to, walk us through what it's like for women, and specifically women of color, when they go to the doctor's office, and what some of the challenges are, and how their doctor can screen for abuse through their medical evaluation. Hi, welcome to the show, Dr. Joyelle.
Thank you. Thank you so much for having me, Dr. Natalie.
I am excited to do this show. I cannot tell you how excited I am to talk with you, and I'm glad that we met on social media. I mean, and that's kind of why I love social media so much.
Yes.
It does help me make some very good connections. So can you tell us a little bit about yourself for my listeners who are listening and want to know more about you, who you are, what you do, and the passion behind your work?
Sure. So like I said, I'm Dr. Joyelle. I'm a board certified OB-GYN menopause mogul who actually empowers Black professional women over 40 to eliminate their perimenopausal symptoms so they can level up in their health and take their business to the next level and be a mogul that they are meant to be. And I became really passionate about this through my journey through perimenopause as I started at the age of 39. I've been in private practice for about 13 years and actually has made the transition into being a full-time homeschooling teacher. And I resigned from my practice so I can pursue my menopause mogul journey and help other women through this journey in their life, in their season.
Yes, that is amazing. Thank you for that. And that is awesome that you do that. Can you break it down for us, for people who might not know?
Yes.
That word is out there all the time, menopause. What is that?
Yes. So yeah, I mean, I think many have heard of menopause as opposed to perimenopause. A lot of like, what is that? So menopause essentially is when a woman gets into the season of her life where she stops having periods for 12 consecutive months, and she can ultimately start to have menopausal symptoms, as opposed to perimenopause, which means around menopause.
Yes.
Women can have menopausal symptoms and still have periods, but their periods start to change at this point. So it's the years that's transitioning them into menopause.
Oh, wow. And
Yeah.
what causes a woman to go into menopause? Because I know that there's several different causes, and I want to ask you about this before we shift gears a little bit.
Yes. Yeah, yeah. So it's actually it's a natural process for a woman.
Yeah.
However, there are women who are basically kind of put into menopause through medical interventions,
Yeah.
like treatment for breast cancer, so chemotherapy or radiation to the pelvic region,
Yeah.
or surgery where they have to have their ovaries removed. So their
Yeah.
ovaries removed, they're actually taking away the main source of their estrogen. So women can essentially kind of surgically induce into menopause. But for the most part, every woman will naturally go into menopause.
Absolutely. Yes. If you live long enough, you'll naturally go
Yes.
into menopause.
Right.
Absolutely. Thank you for bringing that up. And so I
Yeah.
kind of want to shift gears a little bit and talk to you a little bit about why I brought you on. As you
Okay.
know, my show is about narcissism, narcissistic abuse, women in abusive relationships. And one of the reasons that I wanted to bring on an OBGYN specifically is because women come to you with all types of sexual issues or health issues. And a lot of times, medical doctors are the front line of abusive relationships, right?
Right.
Without even knowing it, right? And
Right.
so I
Right.
was curious, excuse me, from your perspective, with you being in practice so long, what what are some things that you have seen clinically that indicate to you that a woman is not in the healthiest relationship?
Hmm. So some things I have seen, um, I can think of actually one particular patient who comes in and, has either an issue in regards to her health in general, or just her demeanor as I walk into the room, and just not, just don't, look like she's happy, or, just really looks down or whatever. And has a certain way that they talk about their partners, where there's some that may kind of, not want to avoid talking about their partner in regards to, sexually transmitted diseases, or them trying to get pregnant. They kind of I think accidentally say like, oh well, my partner doesn't believe that he's the problem at all, and I'm the problem, type of thing, as opposed to coming right out and saying that that may be something that she's not actually believing in herself. But it comes out in different ways. She can blatantly say something in regards to her partner, the way he says certain things to her, or something that I may have to kind of pull out of her just based on her demeanor when we talk about different issues that involves a relationship, if that makes sense.
Yeah, it makes absolute sense. And it sounds like, from what I'm hearing from you, there's it almost sounds like there might be a little bit of shame or embarrassment or timidness in discussing sexual health.
Right. Yeah.
What do you think that's about?
That's a good question.
Because I feel like it is too. Like, I feel like as women, especially women of color,
Yes.
there is this sort of thing that, like, you can't discuss sexual health. You can't be sort of open about your sexuality, you're seen as fast, promiscuous, slutty.
Right.
There's a lot of shame that goes around that
Right.
from societal standards, but
Yeah.
also within our own standards as well. What do you think that's about from,
Yeah, I
you
mean,
know?
there's even women who like they don't even like to say the word vagina. Like they are really embarrassed by that. Like, I mean, I'm like, you can say it. Like they're like, oh, just down there. I'm like, no, you can say vagina. Like it's okay to say that. And I think part of it is, the way we grow up. Like it's not something that we commonly, or a lot of women growing up don't commonly talk about their different parts of their bodies and their sexuality, and just like their sexual health in general, and how actually it impacts them, their overall well-being, honestly. So I think a lot of times as we're growing up, I can even personally say that my mom didn't really bring up sex. Like
Right?
it was just like, just don't get pregnant. I'm like,
Yeah.
okay.
Like, just don't have it at all. Like, we
Right,
don't need to think
exactly.
about
Right,
it.
right. Yeah, exactly. Like, just avoid it. Just it's bad, just bad. So I think a lot of it is, more so how we are kind of groomed to even approach that situation or approach that topic. If we're not really used to saying the words or used to actually having the conversation, they don't, when they get to their doctor's office, or even in their relationships, it's like, it's hard, it's difficult to talk about because it's like they don't really know how to communicate, things that may be going on.
I agree with you. I think, there is that. And I also wonder if that leads to um, more issues.
Mm,
Just the fact of not being able to say that, not feeling comfortable with that. And of course, you're a doctor. So, but even still with a woman doctor, I wonder if there's still that sort of that discomfort with their partner in terms of being able to talk about things. Um, but it also leads me to think about not just talking about it in an educational sense, but also talking about it in a way that explains myself to you, or implements boundaries. Like, for
mm,
example, I have a vagina, you have a vagina. No one should be able to tell you more about your vagina than you, and no one
right,
should be able to tell you more about mine than me, right? But if I can't come to you as as your doctor, or as you're my doctor, and tell you about that, there's a problem, right?
right,
Because there's a part of me that's got a wall up, and who knows what you're doing, or, I don't know, and if I can't tell you about myself, where's that going to go?
right, right. Yeah, yeah. And that's why a lot of women suffer in silence, especially when it comes to their sexual health and their vaginal health, because they're like, I don't really want to talk about it, or I can't really I don't even know what to say. I don't know what questions to ask. They, like, again, they feel embarrassed, or they feel like they're the only one that may be going through whatever they're going through.
Yes.
Like, it must just be me, and
Yes.
I'll just get through it. So
Yes.
yeah, it's difficult.
Tell me, and from your perspective, what do you feel like when women come to see you? What do you feel like is the thing that they're most embarrassed or most ashamed to ask about?
Ooh. Um, Probably their sexual desire.
Hmm.
They are embarrassed that, a lot of them are embarrassed that they don't have, like, they're losing it, that they don't have the desire anymore. So they're kind of, they're embarrassed, they feel bad about it.
Hmm.
But again, they also like, okay, it's just me, so I'll just have to just deal with it, because, and then also, like, a lot of women feel like there's nothing to help them with it. So it's like, why bother mentioning it if there's really nothing out there to help me?
Is that
um
true?
no, no, it's not. It's not. So that's why I particularly make it a point when I see patients in the office to bring up the topic, because a lot of times there's a lot of, just doctors in general, we don't even bring it up. Just, number one, the time that we have with patients in the office. And number two, it can be such a complicated, problem to kind of address, because there's so many different factors that goes along with it, that we don't even bring it up in the conversation. So I purposely, and I will have to be transparent to say I didn't do that at the beginning of my career, because I didn't really know, like, honestly,
Sure. Sure.
just in, early training and just kind of going into my early practice. But as I evolved as a practitioner, I realized like the importance of bringing this conversation up and bringing, making women more comfortable to bring it up in the conversation. And because there's, like I said, it's just so, it's embarrassing. Like I said, they feel like, they're the only ones, or there's nothing else to help me, and this is what I have to deal with, and it is what it is. So yeah, I would say that would probably be the most the most thing that women like I don't want to talk about it.
Okay. I
I
want to
bring that
back
up.
that up for you for a second, because I also
Yeah.
think sexual desire is an important aspect of an abusive relationship, right?
Mm,
There is, can you talk a little bit about what sexual desire is
okay.
versus, and how it's different from I don't want to have sex with you. I don't want to have sex. I'm turned off from that person emotionally. So I'm disconnecting from that person sexually.
Mm.
Are you able to talk a little bit about what you feel like the differences might be, or how women can sort of discern the difference?
Right. So sexual desire just in general is essentially the want to have sex, or the want to just be sexual, just pleasuring, the want to to be be pleasurable, essentially, to have that desire, to have that want. So if, and it's, like I said, it's such a complicated, not complicated, but it's so many factors that go
Sure.
along with that.
Yeah.
So it's not, oh, a lot of women associate that like, oh, I don't want to have sex, and that is, it's because of me, as opposed to, I don't want to have sex with this person because I don't like this person. I have a story. I have this patient. I had a patient who came in, and she, talked about how she did not have desire to have sex. So I'm like asking her questions, and I'm like, well, how do you feel about your partner? Well, I don't like him. And I'm like,
Okay.
okay, let's start
Right.
there. you know? So, you actually wanting to have sex, as opposed to you wanting to have sex with a particular person or your partner in general, can be two different things. So you may,
Yes.
want to have a desire, to have sex, to be sexual, to be pleasured. However, you are in a relationship where you don't want it because you're with this actual person.
Absolutely. Yeah,
Yeah.
that person, or even that, I could see even a relationship being a depressing factor. Like the fact that you
Mm,
even have to look at it as someone, or you're in an oppressive situation with
right.
somebody,
Right.
that just really just kind of shuts you down also.
Exactly. Right.
And so I do think that that's an important part of the screening in versus screening out, versus, whether it's medical,
Right.
psychological, what else is going on, or a
Exactly.
domestic situation.
Right.
There's some other things that I wanted to ask you about, with
Okay.
respect to women's sexual health, of course. I want to try to get as much out of you as possible, right? I'm going to pump you.
Yes.
So, because I think this is, so important. Like you said, this is not a conversation that my mother had with me or your mother had with you. And there's
Right.
probably a lot of women out there who've never had that conversation with their
Mm-hmm.
mothers or daughters or whatever.
Right.
If I imagine that over the years, you've seen women that have been in relationships with partners that have given them STDs or STIs.
Mm-hmm.
Tell me a little bit about that process. Like when women come in to see you and you have to tell them that there's
Right.
some infidelity or something going on. Tell me a little bit about that.
Yeah. It is not a comfortable situation. When I have to give that result, I'm like, oh, okay. Especially women who are married. That is the worst, right?
Ooh,
It's like,
yeah.
you
Or
know,
pregnant. I would imagine
or
if a woman's
pregnant.
pregnant,
Yes.
married or pregnant, I think that would be, or
Yes.
if it's a incurable.
Right. 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 But yeah, it is definitely uncomfortable. I give them, this is what's going on. This is the diagnosis. And I get, different reactions, obviously.
What do you get?
So there are some that are like totally like, what? Surprise, like,
Yeah.
just totally blown away. Like, what do you mean? Like, this can't
Hmm.
be happening, type of thing. Obviously there could be tears, just total breakdown, as opposed to shock, or like, I think there are some women who come in suspecting but don't say it, and then when they get the diagnosis, like, okay, like, they kind of knew, but now they really know, if that makes sense.
It does. It may you
Yeah,
like, but you don't want to say the doctor. You just want the doctor to run all the tests
exactly.
possible and tell you
Right.
what's up. Yeah, got
Right.
it.
Right. Yes,
Got it.
yes, right. So yeah, so those are the, different reactions, based on their reaction, we obviously talk about the treatment and how the importance of having your partner tested and treated, and how we need to, avoid intercourse, before if you do decide to continue on with this relationship. Make sure everyone is tested and negative before
Sure.
you re-engage in that that sexual relationship. And again, it just kind of depends on the situation, in regards to if someone who like I said, comes in suspecting, and really already, either was feeling like they wanted to probably end the relationship versus not, and then kind of, navigating, but what the next step is in regard to, is it, a conversation with your partner, as well as going into therapy. And it really kind of depends, like, this a one-time thing, or first time thing, versus a
Yes.
repeated,
Yes.
occurrence.
Yeah.
So it just kind of depends.
And then that was my next question to you also. And I'm glad you mentioned that because I'm wondering if over the years, if you've seen women that come
Hmm.
in with repeated occurrences of this stuff.
Yeah, I do. And I would say, just thinking, married women I have not seen as much, as
Okay.
opposed to women who are, just have a boyfriend, essentially.
Okay.
Um and and, and I found myself having the same conversation, like, and it's like, they tell me, like, well, he said that he was tested and it was negative. I'm like, well, did you see the result? Did you go with him? Like, it's really, really trying to kind of press on the significance of you actually, seeing results, and not just believing what he says, because clearly, if there's something that's happening over and over again, there's something missing here, as far as communication wise. So, and also, talking to her in regards to how she feels about herself, like, how do you feel worthy, honestly, in regards to you staying in this relationship, and having this happen to you over and over again, and go into the long-term complications of you having this repeated infection, down the line, in regards to your fertility, in regards to your health in general. Like, this is something that, you have to also take into consideration. This is something you predisposing or exposing yourself over and over again is not something that's healthy for you in the long run. And just to say that you, with this partner that you're not married to or in a long-term relationship, you go through this and then ultimately break up at some point, and then, basically set yourself up in a future relationship having some issues because you expose yourself over and over again to this type of behavior, type of thing.
Can you go back for a second? Because I
Mm-hmm.
think you brought up an important point that I don't think a lot of women know about. And I certainly didn't know about
Mm-hmm.
until I had an experience. And that is that repeated exposures to STDs or to certain STDs
Right.
can cause infertility.
Right.
Can you
Yeah.
speak a little bit more about that? Because I don't think a lot of women know that. I think a lot of women may think that, you get an STD or if you get, especially one of the more common ones, you take a pill and everything's fine, or you
Right.
can take some medicine and everything's fine.
Right. Right.
So can you provide us a little bit of education around that piece?
Yeah, definitely. So yeah, like you said, there's particular ones that can predispose women to having fertility issues in the future. So those are particularly gonorrhea, chlamydia, which essentially, if a woman is repeatedly exposed to that, that repeated infection can ultimately travel, because we take the specimen typically from the cervical region, that's the door to your uterus. So that infection can essentially travel up into the uterus, into the fallopian tubes. And that's where your eggs travel to get to your uterus.
Mm-hmm.
So if you have this infection that travels into your fallopian tubes, that essentially scars your tubes. So that doesn't allow the egg to travel to the place where it needs to implant to, produce a pregnancy, or basically kind of meet the sperm to produce a pregnancy ultimately. So that scarring can predispose women to, having that issue and not allowing them to get pregnant, or they maybe get pregnant in the tube, so they can have an ectopic pregnancy. So
Mm-hmm.
that's a pregnancy that's outside the uterus. So they can have a pregnancy that ends up in that tube because of that scarring. It doesn't allow these little things, like little finger-like projections in the tube, to move the egg along, because that scarring allows it to basically kind of stay stuck right there in the tube, and that can ultimately result in the ectopic pregnancy. So, and even with the fertility, going back to the infection in the tube and the fertility, that infection can lead to, that infection, we call it PID, or pelvic inflammatory disease. That can also lead to a tubal ovarian abscess, or TOA. That's even a worse infection, because that basically involves, can go into the actual surrounding pelvis. It can cause bleeding, a more infection that can cause you to actually lose a fallopian tube and ovary because of this infection. So yeah, it can certainly, kind of, lead to these long-term things that can ultimately affect your fertility down the line.
And if I'm not mistaken, I think you're the doctor, so I'll go with what you say. But I think you can get chlamydia or gonorrhea one time and have some pretty significant complications, such as what you're talking about. It doesn't have to
Yes.
necessarily be repeated exposure.
Yes, you are
It could
absolutely
just be
correct.
one time, and all of these things.
Right.
It could go, and I didn't know. Again, these th- those two in particular are very unique in that sometimes, from my understanding, they
Mm-hmm.
can be undetected in your
Yes.
typical STD test.
Yes. Yeah. Well, we undetected
I
in the test.
or like for my, like, I know that there's like standard tests that they run at like your
Mm-hmm.
doctor's office, but sometimes with those two, my understanding is that they can be undetected in your standard STD test. So I know that there's like special tests that you can ask for those two in particular, gonorrhea and chlamydia. That, like, there's some alternative test,
Mm-hmm.
which I learned about. I don't know if you know about that, but I said I wasn't going to get technical. So let me, but that's just something I thought about. Like that,
Right.
sometimes things don't necessarily show up
Right.
per
And,
se.
or some women don't have symptoms, right?
Yes,
Like
right.
they can be totally asymptomatic, unfortunately. So that's why it's also important, especially if you're not in a monogamous relationship, to be tested on a regular basis, so you can be aware if you have been exposed. So yeah, either of those things can happen.
What's the solution for these women?
Mm-hmm.
And we only talked about STDs and that stuff. I didn't even get into people who have unwanted pregnancies, or things that they're,
Mm.
those things that they're kind of exposed to, or they haven't been able to talk to their partner about it or get on the same page. Because I think that's also another important aspect. However, we don't have all day. Because I could go on all day with all this stuff.
Right.
What do women need to be doing? And I don't want to sit here and put all the onus on the women, but
Right.
I do want to speak to the women because that's who we're talking to. But
Right.
with people and their bodies, they're coming to you with this stuff. What should they be doing? What stands out to you as what people should be doing to put a stop to this risk of their health?
Right. Well, number one, respecting your temple,
Mhm.
like really respecting your body and loving your body, right? Like the relationship you have with yourself, relationship with you have with your body really is important. And when we're young, it's like, oh, we're so carefree and it's like, whatever. But we really have to be proactive about just taking care of ourselves in general. So that looks like protecting yourself, like using protection in a relationship, especially again if you are not with someone that you are long-term relationship, or even someone that you really trust. Like there's women who are in relationship that they really don't trust, but they stay with them for various reasons, right? But really
Yes.
taking responsibility for you, not you can't take responsibility for anyone else, but for you, protecting yourself in regards to that. And then when you're protecting yourself, also when you come in for your routine health visits, making sure you are coming in for those visits,
Yeah.
and also getting yourself checked for
Yeah.
things. There's some women's like, oh, I'm fine, I don't need to be checked for that. I'm like, well, it's still
Mhm.
important to know, just to have, it's just information, just to be aware that you're definitely. And and it's funny because there's some who, like, when I suggest it, it's like, well, I'm suggesting that their partner's cheating. I'm like, no, I'm not suggesting that at all, but this is your body, and it's important just to know everything that's going on with your body, whether you feel like something's wrong or not, just to be, again, just be proactive and just to be aware of things that could be going on that you may not even
Yeah.
realize.
Yeah. Or even getting screened together. Can they do that? Can you bring your partner into the OB and y'all get screened together, or do they have to go someplace special for that?
Yeah, yeah, they have to go somewhere special. Yeah, we don't have couples
That would
screening
be,
visits,
yeah. I
unfortunately.
don't
That
know.
would
I
be
think
cool
that,
though, right?
yeah, I think that
Yeah,
they should have more of that. Like, let's go get tested together. And so, because if there's going to be a blow up, or if there's going to be some questions or some boundaries, I do
right.
think that people should be able to go get screened together. Absolutely.
Yeah. Yeah, I think
Yeah.
that would be, that would be a great idea. And the
Yeah.
other thing I wanted to mention, just also just having conversations with your partner around sexual health, and
Yeah.
especially if it's in a new relationship, just asking the questions like, as far as exposure in the past. And I know it's an uncomfortable situation,
Mm.
could be uncomfortable conversation, but it's a conversation that needs to be had, because especially when I talk to women, especially in their 40s, and got divorced and going to new relationships, they just kind of assume that they'll be okay and they will be protected, and the guy is, because he's over
Mm.
40, over 50, he's probably fine. Like, no, that's not the case. So really also being proactive about having those conversations, around STDs and exposure, and really, ask him to be tested before you, engage in that relationship, sexual relationship,
Yeah.
just to make sure that, he's good and you're good. And then you can, do what you do.
Yeah, absolutely. I'm also wondering if there's, more like extreme cases that you've seen where you've really had to sit somebody down and have a come to Jesus moment with them.
Hmm. Yeah. In regards to just STDs or.
Yeah, just their STDs, abortions, health, about their body, and what's really going on. Like we got to have some come to Jesus moments, because just working in the mental health field, I've worked with a lot of people that engage in risky sexual behavior,
Mm-hmm.
not just with abusive partners, but, I've worked with people who've done prostitution,
Mm,
or who've, been going through something emotionally, maybe
right.
bipolar disorder. And it's not to say that people with bipolar disorder are always risky
Right.
in sex, but I have worked with people that have just been going through something, and they've
Mm-hmm.
been engaging in that, and they put themselves in some serious hot water,
Mm-hmm.
maybe multiple times. Has there been any that you've seen like that that have just been just like, "Look, we gotta talk about this. This is getting like serious now.
Yeah.
It's way
Yeah.
beyond serious. Like we just
R-
have to have that."
Right. Right. Yeah. I've definitely had those conversations. And again, it's like, you get to a point like what is it? Like, like I want to help you. Like, what can I do to help
Yeah,
you, help you, um, understand the
yeah,
importance of you,
yeah,
really, like again, taking responsibility and taking responsibility for your body, for your physical health, for your mental
yeah,
health, right?
yeah,
So yeah, I definitely had those conversations in the office,
yeah,
and just really kind of, like I said, just kind of pulling out what else could be going on, other in the relationship, whether in their families, any other stressors, like what else can be kind of
going on.
impeding your ability to really take ownership in this,
Yes.
in regards to, and do the things that you need to do to improve your health, and and make it a continual thing as opposed to just a one-time thing.
Mm,
So yeah, a
yes.
lot of come to Jesus
That's
moments,
unfortunate. That's
unfortunately.
so
Yeah.
sad. That's so sad to
Yeah.
me. And it's understandable too. It's very sad how much faith um how much women kind of can go through sexually, because I think that says something, but also too how much faith you might put in somebody else to have values for you that they really just don't have. And
Right.
that's an indication that the two of you are on two different levels. I do want to
Yeah.
shift a little bit because we have a little bit of time, and I have another burning topic. Um, Again, I'm going to try to keep it. I'm so sorry. Can you hear my rooster? He's driving me insane. The
No,
rooster
I
outside
can't.
my yeah,
Oh.
okay, good. I'm like, oh my. So when you
That's
see me
funny.
like going nuts, it's like because he will not shut up. He always does this every time I turn on the
That's
mic.
hilarious.
He's not
He
mine,
has
but he
nothing
like
to
hangs
say.
out.
Right, right.
So it's like he won't be quiet. Um, that is Black women in OBGYN health, right? It's part of
Mhm.
what we're talking about.
Right.
But what I've read before is that, and kind of what I've been seeing in just some of the data. Again, I'm trying
Mhm.
not to get too technical,
Mhm.
but I've heard that, and I don't know if this is your experience or not, that Black women
Mhm.
have higher rates of things that they're exposed to, in terms of fertility issues. So that could be things like what we're talking about, like,
Mhm.
they're exposed to things that cause, you know, PID, or to cause them to have fallopian tube removals. And I read that it's been a little bit ago that I've read that. And so I just wonder, and I don't know what the demographics of your clientele were, but
Mhm.
I'm just wondering, in your experience, is it more difficult for Black women to place boundaries or to ask questions about sexual health from their partner, uh, than other folks? I don't know if
Um
that's something you have an opinion about, or that you've kind of seen, in your experience.
yeah, I mean the demographics of our practice, I was in group practice.
Yeah.
And I would have to say it was majority white women.
Okay.
Yeah. So, but just to, now that you ask that question, just thinking back, I would say, Black women, in regards to their sexual health, I think, in comparison to white women, they can be, uh, they're not as open. They, not as open to talking about issues, surrounding that, um,
Mm,
just in general.
Mm.
And but for me, I always want a woman to come in and feel comfortable. So I really tried to make this visit's already uncomfortable, right? Nobody
Yeah.
likes to come and see me.
Yeah. No one does.
No one does, and that's okay, that's all right. So I try to make it as comfortable as possible, especially for Black women, because I
Yeah.
know a lot of Black women who has come in from other docs who has felt dismissed, who has
Yeah.
felt ignored.
Yes.
So I really try to kind of pull things out of them in
Yes.
particular, because I
Yes.
know they have prior experiences where they don't feel heard, or they don't, so I really make it a point to again, just ask more questions and kind of dig a little deeper in regards to what may be going on, especially around their sexual health,
Yes.
just so they can feel more comfortable talking with me. And if not that visit, maybe the next visit when they come back, so
Yes.
I have found that Black women can be a little bit more less voluntary in regards to giving that type of information.
Maybe more, I don't want to say guarded, but sometimes more guarded, because that does bring me to my next question. There is not just with OBGYN care, but just medical care across the board, right? It's some
Right.
that's actually been very prevalent in the news as recent as this year. And
Mm-hmm.
last year, especially during COVID,
Right.
where Black women have been dismissed, or Black people are dying at alarming rates because their medical symptoms are being dismissed.
Right.
Um, Broad spectrum across healthcare. What do you do? What do you recommend that women do, or people do, when they are being dismissed by a medical professional? Like, I know something's going on with my body. Like, you might be a medical expert, but I'm always going to be the expert on
Right.
Natalie's body. You know what I'm saying?
Yes.
So you can
Right.
tell, I don't care what your book says, I know that something is missed. So if I know that, and you're telling me, no, it's all in your head, or,
Mm-hmm.
take a Benadryl, or,
Right.
whatever,
Yeah.
right?
Mm-hmm. Right.
What should I
Right.
do if, like, I might have gone to one of you, I might have gone to two or three of you, and you're all saying the same thing.
Yeah. Yeah.
What can I do? Yeah.
Unfortunately, find somebody, find a fourth doctor. Like,
Yeah.
seriously, yeah, I do encourage women. Like I said, you have to be an advocate for yourself,
Yeah.
right? And don't be afraid to, like you said, listen to your body and, like, look, I know what you're saying, but this is what I'm feeling, and I really feel like something is wrong, and really stand in that.
Mhm.
And if if you feel like the doctor that you're speaking to is, like I say, is not listening to you, or just ignoring you, you really have to find another doctor that you do feel more comfortable with, that you do feel like you're being listened to, and really um, engage you into coming up with a decision plan in regards to what your symptoms are, what your
Mhm.
symptoms are, what symptoms you're having at that point.
Mhm.
So really just finding a doc, because I've had women like, have you been to your primary care doctor? Like, no, I don't like them. I'm like, well, why do you still have them? Like, let's
Yeah.
find another primary care doctor. Like, you
Yeah.
really have to establish a healthcare team. Like, it has to be a
Yeah.
team, right? A primary care physician, a
Mhm.
gynecologist, or a therapist, a psychiatrist, a
Yes.
psychologist. So you really
Yeah.
have to have a healthcare team, but
Yes.
the docs on this team have to be someone you are comfortable talking to.
Yes.
So, and comfortable that you are comfortable in asking questions, comfortable that you're
Yeah.
feeling heard, and you feel like they actually have your best interests. Um,
Absolutely.
so really establishing those relationships. And unfortunately, some of us have to go through, like, 2 or 3 or 4 doctors before we
Yeah.
actually find that one
Yeah.
to really feel that way.
And that's
So
very traumatic. That's
yeah,
very traumatic, to not
it
be
is
heard, or not be
right.
listened to, or not be validated. I mean, especially if you've got a woman that's coming in uh, with an STD. I mean, they've basically been not heard by their partner, or they've been disrespected by their partner's
Right.
penis, for lack of a better way,
Right.
and then to be disrespected, or like not heard by a doctor. Like,
Right.
that's just like, I
Yeah.
can imagine being in an abusive relationship, or just being a human being in general, and being dismissed on so many levels, it does cause you to shut down, especially when finances are involved. Now,
Mm.
you are at home being dismissed by somebody, but I got to pay you and then be
And
dismissed.
dismissed. Exactly.
That's a
Right.
lot. That's a
Right.
lot.
That
That's
is
a
a lot.
lot.
Yeah.
And this is not a diss to doctors.
No.
It's not a diss at all, but I do think, especially during the pandemic, in my experience, my personal experience, and just from what I'm seeing on the media, things
Mm-hmm.
have gotten substantially worse in terms of
Right.
people not feeling validated or heard.
Mm-hmm. Yeah.
So I think I definitely wanted to get that out there. Um, when women come to you,
Mm-hmm.
right? They're experiencing something, or they want to know something, or they're just coming to you.
Mm-hmm.
A lot of people don't know how to talk to their doctor. I'm wondering if you could just kind of run us down of some things, some questions that a woman should not be afraid to ask their doctor, or should definitely pump out to their OB when they're talking to you. Like, what should I be coming to say? Like, once again, like you said, I might already be anxious because we both know what you're getting ready to do, and I don't like that. So I'm already in this state, but what should
Exactly.
I like? What should I be prepared, or like what should I just be talking to you about, just like
Right.
off top? And then especially if I'm having some issues with some guy or my partner that I'm not talking to them about, or I can't get a straight answer. Like, what
Right.
are some off top questions that you feel like people should just come in and talk to you about?
Yeah. Well, first, even before you come in, especially if you're experiencing something, write it down. Like, write down what you've been experiencing. Write down things that, if your symptoms are around a certain, time of the month, or around a certain type of food that you've been eating or whatever. Like, write things down and write questions that you may have already had, just so you can even remember. Because there's, they come into the visit, you, like I said, they're anxious, they like hearts pumping, like, oh my God, I don't want to have that speculum exam, and then you forget
Yeah.
everything you wanted to even mention. So I really want to
Mm.
first just have encourage women to write things down before they
Mm.
come into the visit, so they
And
can have
say it
like a
on the
little notepad.
call, right?
Yeah, right.
Scream that
That
my
too.
vagina's on fire, girl. I need to get in. Right? I feel like that's like, say it on the call. Like, don't wait. If they
You
got
can.
an appointment, if it's like mid-April, okay, we can't get you in until July. Like, right?
Right. Yeah. But you listen, you would not imagine, like, there are women who come in, you think everything is fine. They talk to the nurse, the nurses do their vitals and ask questions. They say nothing to the nurse. And then when I
Yes.
get into the room, it's like, and they have like 500 things that they're like going through. I'm like, okay.
That's
So
terrible.
yes, really,
That's
say it
terrible.
so we can
Yeah.
prepare, appropriate things to address your problems.
Right.
So yeah, so definitely I encourage women to, definitely first do that, just to have, a list of things or questions that you may have. And
Yeah.
then, yeah, I mean, you want to, ask your doctor, obviously, just even down to the simple things, as far as your vitals. We get your blood pressure check. What's your blood pressure? What's my blood pressure today? Just so you can have, like, because that's,
Gotcha.
especially with women, heart disease is the number one killer of women. And that the risk factors for that is high blood pressure. So really kind of keeping track with that. What's my blood pressure today? All right, cool. And then just overall health in general, in regards to, from a GYN standpoint, what your periods are doing. Just kind of give the doctor a rundown of my periods are fine, or they're not fine, and they're not fine because of this. This is what's been going on, or I'm having new symptoms in regards to my periods. I have these new
Yeah.
cramps I didn't have before. Things like that. Or vaginal health, some that's changed in my vaginal discharge is different this time, or it smells different, things like that. Or just around, when women are kind of going through
Yeah.
this, over 40
Yeah.
situation, things change.
Yes. I can attest to that. That is very
Right.
true.
Exactly. Right. Things change, mood wise, like, definitely, talk about how you've been
Yeah.
feeling in regards to your mood. Is it
Yeah.
different, or have you been
Yeah.
more irritable, more angry, or just
Yeah.
emotional? things like that. Just kind of, from head to toe, what you've been feeling just in
Right.
general. Or, if there's a particular something that you actually have been going
Yeah.
through, certainly just kind of, like I said, have it written down so we can kind of go through what's been going on and then kind of take it from there.
Absolutely. Thank you so much for saying that. And I think just psychologically, just, you know, Black women need to be more comfortable speaking freely. And I know that that's easier said than done, but
Right.
talk to your doctor. If you have something, it doesn't mean that I know there's also those negative undertones in society that you're dirty, or that you're
Right.
not clean, or you're not taking care of
Yes.
yourself, or you're this or you're
Yes.
that.
Right.
But I would strongly urge, this is my PSA, women to get comfortable with talking, like talking with you, talking to people that are safe for them. Just get comfortable talking about it and being real, because time is very precious. Your body is your temple, like you said. So
Yes.
they really need to get comfortable talking. Do not suffer in silence, because there's so much help available. And keep looking if you don't find it the first time.
Right.
So I appreciate you for coming on the show. And I know that it's been very informative for me. I've enjoyed myself. You're such a lovely guest.
Thank
And
you.
I know you're so wonderful, beautiful, and full of light. And I know that people are probably going to want to check you out. Tell us where we can find you, how we can contact you, and if there's anything coming up for you that we can support you on.
Yes, definitely. Thank you. Thank you for
Yeah.
having me. This was fun. But people can find me at Dr. Joyelle on Instagram and Facebook. And my
Nice.
website is drjoyelle.com. The new thing that's come up for me is I'm launching my Menopause Moguls, The Power of the Pause online coaching program
Nice.
at the end of April, April 25th. And
Ooh,
really, again, just empowering Black professional women over 40 to eliminate perimenopausal symptoms so they can
nice.
gain clarity, focus, and energy to level up in their health and then also take their business to the next level so they can be a mogul.
Nice, nice. Oh, well, I'll be sure to post all of that in the show notes. So this podcast is right on time for your launch.
Yes.
So I'm excited for you, and I can't wait to see what else is coming up for you. So I'm excited about this.
Yes. Thank you. Thank you so much.
Thank you so much, Dr. Joyelle. Okay, well, I hope that you enjoyed that episode with Dr. Joyelle. She definitely dropped a lot of nuggets. And, I hope to hear from you guys and tell me a little bit about your thoughts on the show. And thank you so much for tuning in. Until next time, be well.